Hello from beautiful Vancouver. As co-chair of the International Health Promoting Campuses Network, we are thrilled to support the creation of the Limerick Framework for Action. This is the culmination of collaboration across the globe with scholars, students, and practitioners from higher education, government, and NGOs. This framework builds on the foundations of the Edmonton Charter and the Okanagan Charter and strengthens our efforts to promote health across campuses and communities.
Hi, I'm Rebecca Kennedy from the University of Alabama at Birmingham, and I serve as the co-chair of the International Health Promoting Campuses Network. The University of Limerick, with the support of the Higher Education Authority in Ireland, has done an outstanding job developing the Limerick Framework for Action. This new framework supports our growing international movement and reaffirms higher education as an essential part of any systemic health promotion strategy. Healthy planet, healthy places, healthy people. That's what the Limerick Framework for Action helps us achieve as we work together across continents, united for the health of all.
The Limerick Framework for Action represents a significant milestone for the global health promoting campuses movement. 10 years on, it strengthens the bold vision and calls set out by the Okanagan Charter, proposing 10 actions underpinned by guiding principles and 3 interconnected pillars. I really hope that the framework will inspire and enable higher education institutions and health promoting campus networks around the world to translate their commitment to whole system and whole institution settings-based health promotion into ambitious, tangible and equitable change. Change that can help tackle the intertwined challenges that humanity faces and secure the health, vitality and integrity of the planet, of places and of the people who live, learn, work, love and play in these places, on our campuses and in their surrounding communities.
El marco de acción de Limerick nos ofrece una ruta clara de cómo orientar la gestión del movimiento de universidades promotoras de la salud a nivel nacional, a nivel regional y a nivel global. En el pasado hemos tenido otros documentos políticos y normativos de referencia. En el caso de la región iberoamericana hemos tenido el documento de Coimbra, la Carta de Niterói, y a nivel global hemos tenido como referencia la Carta de Okanagan. Todos estos documentos son expresiones ideológicas y políticas que orientan la gestión del movimiento global de universidades promotoras de la salud. El marco de acción de Limerick nos traza, como decía, esta ruta de cara a los próximos años de iniciativa del movimiento de universidades promotoras de la salud. Le damos la bienvenida a este documento que constituye una referencia primordial para todos los que estamos vinculados al movimiento de universidades promotoras de la salud.
The Medical University of Varna, Bulgaria is still at the beginning of our journey on the healthy campus road. The Okanagan Charter and the Ottawa Charter were the main documents guiding our efforts up to that moment. And now we are very grateful to our Irish colleagues for the new Limerick Framework for Action, giving us not only 10 clear action areas, but also answers to the questions on what, why, and how we have to act. We send you our warmest greetings from the first health promoting university in Bulgaria, the Health Medical University of Kara.
Aoife Noonan, a PhD candidate at the University of Limerick working with Healthy UL, and I've had the privilege over the last 2 years to collaborate with many individuals from across the globe in co-creating the Limerick Framework for Action. Built through an evidence-informed process, including surveys, interviews, focus groups, workshops, and many months of collective drafting, the framework reflects a vision for a healthier planet, healthier places, and healthier people. It brings forward the voices of students, employees, and communities who are ready for higher education to lead meaningful and lasting change, locally, nationally, and globally. To everyone who contributed, your insight shapes this collective achievement, and look forward to seeing how the Limerick Framework for Action inspires campuses to think globally, act locally, and create healthier futures for all.
On behalf of the National Network for Health Promoting Campuses of Georgia, we endorse the Limerick Framework for Action. We commit to embedding health, equity, and sustainability across campus life, strengthening mental health supports, advancing tobacco and vape-free environments, promoting active living and healthy food, and using data-driven partnerships to turn policy into practice for every student and staff member.
Where do you see the key advantages of the Limerick framework for our Austrian network?
For me, the greatest advantage is the shared ethos of stewardship for planet, places and people. It gives our network a common foundation and inspiration and direction. So it helps all members to collaborate more effectively, creating a truly health-promoting campus culture.
I agree. And the framework brings a clear, action-oriented approach. It helps campuses move from ideas to concrete steps, and the emphasis on localizing the framework makes it adaptable to our specific context.
Exactly. So overall, it gives our network a solid structure to advance the health promotion campus agenda together with all our member institutions.
Hi, bonjour from Canada. The Canadian Health Promoting Campuses Network is excited about how the Limerick Framework for Action can help us build upon the legacy of the Okanagan Charter launched right here in Canada in 2015. We're proud to have 55 colleges, universities, and SAGEPs that have adopted the Charter and made commitments to action, along with 8 partner organizations that have endorsed the Charter and pledged their support for our work. The Limerick Framework offers an opportunity to re-energize and reimagine this movement. It will help us to connect our campuses, share learning, and deepen our collective impact on health, well-being, and sustainability. We're already seeing renewed engagement and momentum across Canada as a response to the framework, and we're eager to align our efforts to advance the Global Health Promoting Campuses agenda. We're proud to be part of this international community for change. From coast to coast to coast, we're building healthier campuses, unis pour la santé et le bien-être.
Namaste friends from India. I am Dr. Rajiv Veeraudekar, the Provost of the Faculty of Medical and Health Sciences at Symbiosis International University, Pune, India. We recently had the privilege of attending this conference at Limerick in Ireland, and the conference provided an excellent opportunity to network with like-minded individuals who are working tirelessly to promote the concept of a health-promoting university. In India, this concept is still nascent and is catching up. But as Symbiosis International University, we pledge ourselves to develop Symbiosis International University as a health-promoting university, understanding global best practices and trying to incorporate the same into our constitution, our work processes, and the very culture and fabric of our university. It has indeed been a wonderful learning networking experience, and we look forward to take this momentum forward at Symbiosis and in India. Thank you.
Hi, I'm Chris Daw, past chair of the U.S. Health Promoting Campuses Network and a proud member of the International Steering Group. For the past decade, the Okanagan Charter has guided our work. And every time we introduce it, the most common question is, sounds great, but what do we do now? The Limerick Framework for Action is that practical guide to help us move from vision to action on our own campuses and as leaders working with members in our networks. In the U.S. network, we've already started using the 3 Ps from early drafts. We've been building our monthly shared learning discussions around partnership, participation, and progress. We're deeply grateful to the framework team for compiling all the feedback from around the world to create this incredible resource. Today marks another major milestone in our shared global journey toward well-being for planet, place, and people.
For the UK Healthy Universities Network, the Limerick Framework for Action will embolden our membership. It will give institutions the confidence, tools and shared language to take bold action and lead change. By adopting this framework, UK universities can benchmark progress, share best practice and demonstrate leadership in creating inclusive, supportive environments where students and staff can thrive.
Hello from the Australian Health Promoting Universities Network. We acknowledge and pay respect to the First Nations people, traditional owners of this huge country.
The Limerick Framework for Action for us in Australia hopes to be our guiding document that will support our national health promoting campuses movement. Our network is excited to engage with this as we plan for systems-based change and embed health in our policies, practice and culture. This is our moment in Australia to lead, collaborate, and to shape a future where every campus becomes a catalyst for thriving communities.
From Wurundjeri country in Melbourne City, Victoria, our network is excited about the work that's been done and committed to adopting and implementing the Okanagan Charter and the Limerick Framework for Action.
From Yagara and Turrbal country, which is Mianjin or Brisbane, the Limerick Framework gives us a clear pathway and opportunity to embed health into all aspects of campus culture.
From Awabakal country, Mullumbimba, Newcastle, we look forward to collaborating with this international health promoting community of practice and research. Enjoy the launch. We are with you in spirit. Hey!